Asked you who you have for insurance and how much you pay, I would get a wide range of responses. Next year, I'm turning 26 years old, and that means I'm no longer going to be covered by my parents' insurance. This has prompted me to start doing some research into different insurance methods, not just in the U.S. but across the world. That has led me to find that Norway actually has one of the top regarded healthcare systems in the world. This actually works because my heritage is from Norway, so it kind of gave me an excuse to kind of look into it a little bit more. So, today, what I'm going to talk to you about is the healthcare system in Norway, what it is and how it works, why it is better than ours, and what barriers we face in the US to try and implement something just like it. First, let's talk about Norway's healthcare system. In Norway, everyone is covered. It doesn't matter where you work, how much you make, you're covered by a universal healthcare. There's not a bunch of different companies, not a bunch of different payments. It's the same. It's called a single payer system. In the single payer system, there is just one insurance for the entire country. Doctors don't need to worry about if they accept it or not, and they can't decline you for it because it's what everyone has. In the US, however, there are many different companies, ranging from Blue Care Network, Blue Cross Blue Shield, Aflac, tons of them. And then within those companies, your rates can vary depending on how much coverage you actually want. One barrier that we run into in the US is that a lot of these companies are not universally accepted. For example, I have Blue Cross Blue Shield and can pretty much go wherever I please. My wife is covered by Blue Care Network, and we found that's not necessarily accepted everywhere. John P. Kirkwood spoke about the lackluster health insurance system in the US in the Washington Law Review in 2016. He states, many studies have found that the US spends nearly twice as much per capita on healthcare as other developed countries, while achieving inferior results on such important public measures such as life expectancy and infant mortality. Medicare is the closest thing to a single payer system that we have in the US. Medicare, kind of like what they have over there, is government run, and it's just one cost no matter what. So why is this system more effective than what we are currently using? Well, the obvious one is that it's one cost for everyone. It's much easier for everyone to do, less to worry about for the families. Plus, you get the same treatment no matter where you go. You're not weeded out based on what doctors accept your insurance. They all give you the same care no matter what your socioeconomic status is. And payments and coverage are all the same. Liz Seeger wrote in an article for Medical Economics in 2016 that many physicians worry that patients cannot comply with care plans because high premiums and deductibles prevent them from getting necessary medications or follow-up care. A single payer system would eliminate all of this concern. Same coverage, same cost for everyone. Providers are not able to discriminate. There are a handful of barriers preventing this from happening anytime soon, though. Two main arguments. First, quality would decrease. People are worried that if it was the same coverage no matter what and everyone had the same everything, that care providers would start decreasing the quality of care they give because it's the same for everyone. Another one is that doctors and hospitals would become overloaded. All of these people would have been waiting to get health care, and all of a sudden it would be one universal system and everything would be flooded. They're also worried that if this were to happen, the loss of jobs that would happen. We have so many different insurance companies here in the US, all of those people would then be without jobs. Today, we've covered Norway's healthcare system. They have a single payer system. We talked a little bit about what that is. Talked about some of the benefits compared to the US's current healthcare system, and what barriers face the US in trying to implement the same kind of system here. Paul Redstone sums this topic up perfectly in his article for the Clinical Psychiatry News in June of 2016. He says, as physicians, we are in the business of helping people by treating and hopefully alleviating suffering. It shouldn't be our problem to figure out how our patients can pay for this treatment. But if they can't pay for it, what good is our training, intention, or business? Thank you.